Afternoon, everybody. I think we will get started. We are expecting a few more people, but I think, we are sort of 3 minutes past the starting time as it is. So just wanted to say welcome to everybody and thank you for joining us this afternoon. I appreciate you're all really busy, so taking time out of your day to attend things like this is much appreciated. So what we wanted to do today was to really talk to you about the new Level 3 Diploma in Adult Care that we are now going to launch in January 2023. So we just wanted to talk you through that today, what's happening, what the new qualification consists of. So just wanted to introduce myself and my colleague. So my name is Dion Broughton and I am the product manager currently for healthcare, childcare and education and training. I was, up until April of this year, the product manager for health and social care, which included adult care. My colleague Trudy Murray is on this webinar as well with me because Trudy was the product manager for health and social care for BTEC. And Trudy has now taken over the work-based learning portfolio. So Trudy is here as well today just to introduce herself and to talk you through some of the new aspects of the qualification. Okay, so the Level 3 Diploma in Adult Care. I'm just going to reiterate, and I'm sure that you already all know this, that Skills for Care conducted a consultation where they sought feedback about the Level 3 Diploma in Adult Care, the criteria, what was missing, what people felt was relevant to keeping the qualifications, etc., etc. Then they reviewed the whole of the findings with subject matter experts. And in 2021, in May 2021, they produced a specification for all of the awarding organisations to produce a new version of the qualification based on the feedback that they've had during the consultation. So I know we've talked about that before and I know you are all aware of that. Okay, so we always said that the qualification would be for launch in May 2022. As we got nearer and nearer to that date, we realised that we weren't ready to launch. And then, therefore, it was unfair to expect you to launch if we gave you the spec just a few weeks before you were expected to deliver it. So we talked to Skills for Care and we explained that we didn't want to put our centres in a situation where you were disadvantaged and you were having to deliver the diploma when you really hadn't had time to prepare. So based on that conversation with Skills for Care, we have decided that we will now launch the diploma in January 2023. So we will finish off the year with the existing diploma and we will start the new diploma in the January, which we hope gives you time to plan and prepare. We appreciate that a lot of you use ePortfolio, so you're going to need to upload the documentation. And as well as for assessors, you're going to need to have time to really digest the new content and the expectations of your delivery. So that's why we've made that decision to hold back the launch until January. Okay, now again, I don't want to teach my grandma to suck eggs because you're all competent in the delivery of the qualifications already, but the purpose of the qualification remains the same. So if you are delivering that diploma in adult care as a standalone qualification, it's funded on the adult funding loan list. So, and again, it's for learners who are employed in the role of a lead adult care worker. If you are delivering apprenticeships, you will know it's a mandatory requirement in the lead adult care worker apprenticeship standard. So learners must achieve the qualification together with all the other components, the maths and English requirement, the care plan. They need to achieve all of that before progressing through to the gateway for the endpoint assessment. So the BTEC Level 3 Diploma in Adult Care fulfills the mandatory requirement of the qualification. The qualification that's already listed in the apprenticeship standard, as you will see, this has got the same name, and that's on purpose because we didn't want to have to go back through amending the apprenticeship standard to name a different qualification. It was just all very complicated. So the Trailblazer group agreed that we would just keep the same qualification name. Qualification is a direct replacement for what we currently have. So I've just put the number in there, the QUAN number in there. That qualification will expire on the 31st of December 2022. And we hope that you will have time to prepare to deliver the new one. This is a slide that I used in, I think it was in November, when we did a webinar in November about the new versus the current. And as you can see there, the TQT, the GLH and the credit value, nothing has changed in this level 3 diploma in adult care. So how you plan and prepare and deliver the qualification hasn't actually changed, in the sense of you're going to be doing the same GLH, TQT and the credit value is the same. Now I've put a link here at the bottom to say the full specification can be found on our website. And just to say that it's not there currently, but I have, and I forgot to say, and I apologise, that in the handout section on the control panel, I have dropped this PowerPoint in there for you to keep and use with your staff if you want to. I've put the link to where it will sit. It's currently sat with typeset. It's just being typesetted and it's just been finished and it's in pre-publication. And I didn't want to put a pre-publication on there in case there were any changes at all. So within the next 2 weeks, it will be on the website. I will communicate in, Trudy will communicate in the Insight magazine of exactly when this full specification is on the website. So you will be able to download that and start making your transition with that, with the specification. So I've just put the link there, but it's not there at this moment in time, just to be aware of that. Okay, now the slight changes we've had is in the current specification, we've got 9 mandatory units. We've now got a total of 13 mandatory units. So again, there's ones in there that you are used to delivering, ways of working, safeguarding, duty of care, communication. That's all, you know, all in the existing qualification. The difference that we've got unit 3 here, which is mental capacity and restrictive practice for adults in care. Trudy's going to take you through that unit in a moment, but that is a new unit. Now, traditionally, we've had that within the optional units, but through the consultation, this was seen as something that was missing in the qualification, and that's why Skills for Care have created content and a unit around that subject area that we've not had in mandatory before. The other units that we've got, again, there's no nothing there that you haven't seen before, or that you're not already delivering within the mandatory content. What we have got is Unit 11, which is infection prevention and control in adult care. Now, this really came from COVID. So a lot of people from COVID, a lot of via the consultation, a lot of feedback that came back was how important it is to incorporate that and the importance of infection prevention and control in adult care settings. So that's become a mandatory unit, and we've not had that before. Okay, optional units. When we were developing the diploma, we started looking at the optional units that we had in the current qualifications and how they've been used over the last 3 or 4 years. So what we've done, we've brought over 59 optional units that were in the existing diploma, and that's based on usage data. So where we've got units that have only had 1 or 2 registrations over the lifetime of that qualification, we've made the decision not to include those. So we've tried to streamline it a bit. Otherwise, we'd end up with lots and lots of optional units, and it just gets a little bit complicated and messy. What we've done, we've been working with the British Institute of Learning Disabilities. They came to us because, as you know, in the previous version of the qualification, we used to have pathways, and learning disability was a pathway, but in the new qualification, that's not there's no pathways. So the British Institute came to us to talk to us about the importance for them of having learning disability units for them to deliver in their specialist area. So we've created with them 7 new optional units. So I don't know if your setting is working with learners with disabilities, but we've got new optional units in there if that's sort of the specialist area that you're working in. Okay, now the other thing that came from the consultation was about digital and the needs for people to be more digitally savvy, have better digital core skills in a social care, social worker setting. So we've taken guidance from Skills for Care and what they've drawn on is the work of Go on their basic digital framework model, which they're saying all care workers should be able to manage information, share data, use digital skills in direct care and be able to learn and develop digital skills. So we've actually used that model within our qualification. We've talked about the importance of digital and we've talked about how to incorporate digital into the portfolio and into the evidence. And again, we've reached out to Skills for Care and we've used their guidance on how to incorporate digital skills in social care settings. So there is a section in the specification that talks about this and the importance. But what we've also put within the specification is about for learners who require further development of digital skills, we've got essential digital skills qualifications that you can draw down funding and run alongside the qualifications if there are digital needs. But I'm sure that's all part of your, when you're onboarding learners, you're doing your initial assessments and you're looking at what, how they need to improve, whether that's maths, English, IT. So if that is in there and we've got that essential digital skills qualification that's worth a look at, and again you can draw down funding to deliver that qualification alongside the level 3 diploma. Okay, approvals. So if you have approval for the existing level 3 diploma, Trudy will be working with the assessment team. So any centre with current approvals and no sanctions, you will receive auto approval for the new version. So you don't need to do anything. We will automatically approve you for the new version of the qualification. Direct claims, same as we did last time, direct claims will not be applied. You'll need 1 SV visit to be able to release your certification. And that's because of the we've gone from 9 mandatory units to 13, and we've got those 2 units in there that have now become mandatory requirements. So direct claims will not be applied, but you will get your auto approval. So as I say, you don't need to do anything about that. Okay, I'm now going to hand over to Trudy, and Trudy is going to talk you through the Unit 3, which is the mental capacity and restrictive practice for adult care unit that is in the qualification. Just talk you through it, just to really sort of make sure that you are happy with what you will be delivering, and say any questions we can put them in the chat box. And sorry, I did forget to say at the beginning, if you've got any questions, please do put them in the question box and Trudy and I will address them at the end of the webinar. So I'm going to put myself on mute and hand over to Trudy now.
Thank you, Dion. Hello everybody, good afternoon. As Dion mentioned at the beginning, I'm Trudy Murray, and historically I've been the product manager for the Health and Social Care BTEC, and this April I was also gifted the role of product manager for adult care. So thank you very much for joining us this afternoon, and I look forward to working with you all in the future as we move forward. So I wanted to just talk through the Unit 3 mental capacity and restrictive practice for adult care unit. Having looked through it, I honestly don't think there's really any content there that you're not already familiar with. It's just been pulled out of those units where maybe it was threaded through and maybe a bit more subtle to be in this much more obvious unit of Unit 3. Thank you, Dion, if you could move forward. Thank you. So the overview of this unit really is that you will be talking to your apprentices and talking to your learners about how to consider decisions that are being made on behalf of other people, whether or not that person has mental capacity, whether or not there needs to be any consideration towards removing capacity to any degree. The unit will also ask you to support your apprentices to understand when restraint and deprivation of liberty is appropriate and also proportionate, of course, to the needs of that individual. So the Mental Capacity Act really is a kind of underlying piece of information that goes throughout this unit. We're going to show you the learning outcomes for the unit, and I'm also going to add to that by giving you some sort of hints about the kinds of content that we're asking you to deliver to be able to meet those learning outcomes. Thank you, Dion. Next slide, please. So the first learning outcome, there are three, is to understand the principles of Mental Capacity Act. So the purpose and principles of relevant legislation, the factors that influence an individual's mental capacity, relationship between capacity and consent, and valid consent. So a summary of what we're asking for you to be able to deliver there are the principles, including the best interest principle. So the acts and decisions that are made by healthcare practitioners in the best interests of another person. The need to assume capacity unless it's firmly established otherwise, and we all know that that's a lengthy, documented process. So it's that not rushing to assume that someone doesn't have mental capacity. It's doing everything that you can to assume that they do, and that also includes, of course, the freedom for an individual to make unwise decisions, unwise in inverted commas, because of course what might seem unwise to us is perfectly reasonable to them. And also to be able to explore those alternatives to reaching a conclusion, to achieving a purpose that don't necessarily restrict an individual's rights and freedom of action. So that's the principles of mental capacity that we're asking you to go through to consider 1.1. The legislation and codes of practice are exactly as you would expect. You've got the Liberty Protection Safeguards, Mental Capacity Act, Human Rights Act, Equality Act, the Mental Health Act, the Health and Social Care Act, the Care Act, and the Data Protection Act. Things that you would absolutely assume would be part of this area of teaching. And then when it comes to the factors that might influence, we're giving you quite free rein in that, because of course it can be fairly different for individuals as they move through life and move through age and move through needs. But of course, what we have said is factors could include, but are not limited to, fluctuating capacity, time and decision specificity, as well as environment, noise, time of day, coercive and controlling behaviour from others, and so on. So there's quite a lot of freedom for you to be able to explore factors that influence mental capacity in the kinds of people that your apprentices are working with. Next slide, please, Dion. So this next learning outcome is about the application and principles of mental capacity and consent. So it's about apprentices knowing their own role and responsibility with regards to mental capacity and consent, and upholding someone else's rights, of course. Why it's important to establish consent when providing care and support, how personal values and attitudes influence perceptions and situations of individuals' capacity, strategies and skills to support others to make choices for themselves. Apprentices will look at their own role in identifying when an assessment of capacity may be required, and the steps to take if consent cannot be readily established. So within that, of course, we ask you to look at exactly what is consent, what's the definition of consent with your apprentices. The role and responsibilities, we're framing that around 5 key principles: presumption of capacity, supporting individuals to make their own decisions, freedom to make unwise decisions, acting, of course, in someone's best interest, and taking the least restrictive option. Okay, strategies and skills include things like communication and engagement skills, providing information in different formats, so taking into account different communication needs, using communication aids, addressing environmental factors, listening and recognising and responding appropriately to coercive behaviours. And the steps to take, of course, will include adhering to the principles of the Mental Capacity Act, as well as organisational policies and procedures, and including best interest decisions. And of course, within your organisational policies and procedures, you've got your local policies and procedures with regards to your own local authorities as well. So that's how to sort of frame learning outcome 2. Next slide, please, Dion. So learning outcome 3, about understanding restrictive practices. Now, as you can see, this is all kind of explained. So this is you imparting the knowledge to your apprentices. So really it's about defining what is restraint, what is restrictive practice. We have included the statement from Skills for Care within the unit content there that states that any restrictive intervention must be legally and ethically justified and absolutely necessary to prevent serious harm and must be the least restrictive option. Obviously, as Skills for Care are the governing body, for want of a better phrase, for this qualification, it's of vital importance that you share that with them. We've also given you a piece of content around how to raise concerns, including the whistleblowing policy and what potential action you could take if your concern is actually about the senior managers within a setting. So the unit remains internally assessed, so that's completely done by you. And to be able to pass the unit, learners must present for assessment that they can demonstrate that they meet the required standard within the learning outcomes and in the assessment criteria. So hopefully there isn't anything really within that unit 3 that is a terrible shock and terrible surprise to any one of you. And it's probably, in all honesty, things that you do on a day-to-day basis and that you've certainly woven into other areas of units that you've delivered in the past to your apprentices. So in that case, really, it's just about emphasising that this is an incredibly important area of adult social care. Next slide, please, Dion. So this is just to remind you that we have, of course, been working with Skills for Care on this specification, and it is therefore eligible for the Workforce Delivery Fund. I hope that's right. Workforce Development Fund. I do apologise. So that you can draw down some additional funding from Skills for Care when your apprentice completes the on-programme part of this specification. Next slide, please, Dion. Okay, so now is the time to open up the floor to any questions that you might have on the specification. Hopefully by now you will have seen the message that I've put into the chat box. I have been in contact with the rest of the team who kind of manage more of the specification development process, enabling us to be able to put it online. And their sincere hope is that the specification will be available early next week. So when you do have this slide deck, if you check probably about this time next week would be quite reasonable. Please do check the link on the website and it should take you to that new specification. As Dion mentioned, there are a lot of units that you are more than familiar with and you've probably been delivering in one format or another for many years now. Unit 3 really is that one that it sort of stands out, and of course the infection prevention unit is one that you've undoubtedly been delivering over the course of your career of teaching and assessment in multiple different ways, potentially just not as its own unit. So hopefully you'll be quite excited by the updated specification.
I don't know if we've had a problem, Trudy. There seemed to be some questions. People said they can't see a PowerPoint.
Oh, really?
Just a screen headed, let's get started. I don't know if anybody can pop in the chat or in the questions to say that they could see the PowerPoint. I had included the PowerPoint in the handouts, so hopefully if people couldn't see, they might have been able to pull up the one that was in the handouts.
I can.
Oh, somebody's. I think Craig said, yeah. Oh, okay. It might have been a problem with the just with. Yeah. Okay. So realised I had another button on the top and was able to see it. That's fine.
That's fine.
Good. I think I thought we were waffling on, and then nobody could see the PowerPoint.
Yeah. No, that's fine.
I don't know if anybody's got any specific questions, or you're happy with the fact that we have delayed delivery, delayed the first teach date, or it's caused you any sort of problems. Most of the centres that I've spoken to were happy to continue for the rest of the year with the existing qualification and then start afresh, which is why we made the decision of January, because it's kind of new year, new start. Most people seemed okay with that. Don't know if there's any other questions.
Nothing coming through.
No. Well, on the PowerPoint, I've included mine and Trudy's email addresses, but obviously Trudy is the product manager now for adult care. So if you want to get in touch with Trudy or myself, if you've got any questions that you think about afterwards, or you want to ask any questions to do with the adult care sector apprenticeships, the recording of this webinar will be going on our website. So if you want to listen to it again, or you want to pass the recording link on to any of your colleagues, please do so.
Other than that, if you don't have any questions, and certainly none are popping up, then thank you very much for your time.
Okay, what I will do, I will stop the recording.
Okay.